Y'all better be nice to me. Okay. Are you ready?
Good.
All right. Asthma is a chronic condition that affects many Americans. It's often lifelong, and so many Americans deal with this daily. The Center for Disease Control states that 1 out of every 12 Americans have asthma. That's equivalent to about 25 million Americans. In 2011, it said that 4.1 million kids under the age of 18 had some sort of asthma flare-up. When I was 14 years old, one of my very best friends actually died of an asthma attack. Fast forward 15 years later, and I'm told that my 3-year-old little boy has the same condition. Horrified, terrified, does not even begin to describe how I felt that day, and I still feel every day knowing that in the back of my mind that happened to Sonia. We can now look at one of the most common issues that's associated with asthma, and it's called triggers, flare-up, asthma attack. Different names for it, they're all the same thing. One of the biggest misconceptions is that you don't want to exercise when you have asthma, that it can cause a flare-up. Realistically, it can, but if you control it, if you do moderate exercise, if you don't overdo it, it's going to be okay. I mean, it's everything in moderation. Allergies can cause your asthma to flare up. There are tests that can tell you what to avoid, what's going to cause your flare-ups. And if you have irritants to certain things, you are at a higher risk of having a trigger. There's different tests that you can have done to tell you what you're allergic to. There's skin testing, which is non-invasive. It's often done in the doctor's office. There's blood tests. Yes, it's a little more invasive, and the results are not as quick with that. To treat it, some people actually resort to allergy shots. This is a more controversial topic. People believe that if you're exposed enough to a certain irritant, that your body will build up a barrier to it, and it's not going to be as bad as it would be had you not had that allergy shot. There are things that we cannot control, whether cold and flu viruses, but they will cause your asthma to flare. They can cause your asthma to flare up. As a result of the flare-ups, we can actually look at the treatments there are for asthma. This little red inhaler is a rescue inhaler. This is what you're going to take in the middle of an allergy attack or if you feel one coming on. This is ProAir. There's also Ventolin, albuterol, same thing that's in a nebulizer. This is called a spacer, and what this does is it almost acts as a nebulizer, but you can put your inhaler in it, and it has the same mask as a nebulizer. This is better for little kids because they don't understand really how to use an inhaler. This is preventative. This is what you're going to take long term. It is not going to help you if you are in the middle of an asthma attack. What it does is it puts just enough steroid in your lungs to help you should you have an asthma attack. You will still take your rescue inhaler. And then there are oral medications that you can also take. Prednisone is probably the most common, but like I said, it's not going to offer you any type of quick relief should you feel an asthma attack coming on. Now that we have discussed the triggers and how to control it, there is a lifestyle that's associated with asthma. One of the biggest is you don't want to smoke should you have asthma. It's like a double-edged sword. You're going to have the issue of your asthma on top of the shortness of breath from smoking. They don't mix well. You want to maintain a healthy weight. Should you get sleep apnea on top of your asthma or anything like that, I mean, it can cause chronic problems for many Americans. There are apps that can help you control your asthma. One is called Asthma Buddy, and it'll hold an asthma action plan should you have one of these. Green is good, yellow is obviously moderate, red is you probably need to be seen or get your issues together. It will give you medication reminders, like I said, and then there are apps that can notify you of environmental factors should you have those problems too. I hope I've given you an insight on how people manage and control their asthma, and their struggles are real, but I want you to remember that these people are not sick. I hope I've given y'all different insight as to what people with asthma might deal with. What I really want y'all to take away is Sonia. Had we had this 15 years ago, there's no telling where she could have been. Medicine's changed, so it's just with today's preventative medicine and our up-to-date everything, asthma can be controlled and you can live a normal, healthy life.